Hi, my biology students. How are you? I feel like I haven't seen you in forever. I hope you're doing well. We didn't have a lot of instruction last week because we were already pretty much done with that chapter. We just did some final labs and review and then some more review. And so your test is this Friday, so hope you're getting ready for that. But we're going to, in the meantime, start in a new chapter, chapter 20. I'm super excited because I love this chapter. Anybody that's an athlete or just interested in how your body works and the best way to take care of it should also be interested in this chapter. So we're starting off on the immune system, which works perfectly because we were just talking about immune systems with viruses and bacteria. But we do want to kind of start learning names of things. So when your doctor says, oh, you need surgery on your medial menisci, thankfully, doctors know what medial means. So we want to learn all that too, so we can talk intelligently using certain terminology. So I'm going to have to demonstrate. So I'm going to get up here and move my chair. So when we're talking terminology, first of all, we can divide our body into different planes. We're not one plane. We are multi-dimensional in that sense. So if I were to divide my body into two right and left halves, so dividing right down the middle would be down the median, and this is the sagittal plane. A sagittal plane could be right down the median, like I said, or it could be here, it could be here. They would just be unequal halves, but it's a right and left half. I could divide myself a top and a bottom. And this one has a couple different names. This could be what I call the Darth Maul cut. So picture right there. This would be a cross section. It could be a horizontal. So we could use either one of those. And then if I were to cut myself, if I turn like sideways, like right here, so I have a front half and I have a back half. So this could be frontal or coronal, and then the back portion would be called dorsal. So think like the dorsal fin of a dolphin. Okay, so let's see. Those are the planes. Then we also have some directional terms, and they're usually terms that will be opposites, or we'll use them for comparisons. So, for example, if I talked about that midline or the median of my body, anything closer in to the midline of the body would be considered medial, and everything farther away from that midline is lateral. So if I was talking about my knee and I was to hold my knee up, you can kind of see her too a little bit, I hope. The inside of my knee is more medial, the outside of my knee is more lateral. So we talked about you have a medial menisci and a lateral menisci. Okay, so I could do that in relative terms though. So I might say that my shoulder is lateral to my sternum. Okay, so we would use them in comparison terms. Another pair that gets kind of mixed up with medial and lateral is going to be used when we're talking about usually the extremities. So when we break our body down, you have an axial skeleton and an appendicular skeleton. So our appendicular skeleton is our arms and our legs. And then the axial is kind of, think of like an axis, the middle. So it's our head, our ribs, our vertebral column, down to the pelvis, not the pelvis, but the coccyx part of it. And then the tailbone, which is the coccyx, so and the sacrum. So when we're dealing with appendicular, that's our arms and legs. So when I'm talking about distal and proximal, that's the other two pair. It's going to be really when I'm talking about my arms and my legs. So if I were to compare anything closer up to the attachment of my body, so my arm attaches up here to the shoulder, anything closer up or higher up is going to be proximal. Anything close, or excuse me, farther is distal. Think distance, okay? So again, I would use it in a comparison term. So I might say my elbow is distal to my shoulder. My fingers are distal to my elbow. Or I could do it the other way. Let's use proximal. So I could say my knee is proximal, or more proximal, think of it that way, than my ankle. So usually you're using those two terms with your arms and your legs. Okay, so then we have superficial and deep. That would be pretty common sense. I think I can sit down for this one. So when someone is saying to you like, oh, you're like, oh, I have a cut, and you're like showing someone your boo-boo, and they go, oh my gosh, that is so superficial. Why are you whining? That means it's not that deep, right? But someone else looks at it and they go, oh my gosh, that's deep. You're going to need stitches. So that means it's farther in. So again, it would be comparison. So let's say I was talking to you and I asked you, what is more superficial, your heart or your sternum? So you would hopefully correctly say, my sternum is superficial to my heart. So anything deeper in is deep. Anything closer to the surface is superficial. We'll be learning tomorrow the layers of the skin. So you would say the stratum corneum is superficial to the stratum basal or stratum germinativum. So that's how we use those terms. Then we have superficial and inferior. So anything higher in my body is superficial. Anything lower down, anything up higher is superior. Anything lower is inferior. So, you know, my knee is superior to my ankle, you know, things like that. So then we can have frontal or more anterior and posterior. So again, anterior would be towards the front, posterior is towards the back. And I can use things like my thoracic cavity, which is the cavity that holds my lungs, and my heart, my esophagus, my trachea. That is more superficial than my spinal cord or my spinal cavity, where the cord is encased. So of course that's in the back. So that's how you'll use those terms. And so we want to get comfortable using them. So when I talk about certain things, like I might say you have a lateral collateral ligament or a medial collateral ligament. So we need to be able to know where those are. We will have a quiz on this, and usually the quiz is a statement, and then you have to pick. I give you the two, you know, usually some options, the pairs, is the superior or inferior, or lateral or medial, you know, so you'll have choices, but we want to start learning how to speak intelligently when we're referring to parts of the anatomy. So I think I got them all. If I missed something, I will double back around. But in the meantime, after you've watched this video, we'll have a little practice dry run for that quiz. So be looking for the follow-up assessment from this video. I hope you guys are doing great, and hope to see you stopping by when you have a question, or if you just want to say hi to the open office hours. Take care. Bye.